The Nordic countries have the world's healthiest cows, supported by high production and the lowest use of antibiotics and hormones. Since the 1980s, they have focused on balancing health with production traits. The goal? Breeding long-lasting cows that make dairy farming more profitable and easier. So how can dairy farmers effectively breed for health to improve fertility, longevity, and production? And how can better animal welfare improve your herd's efficiency and profits? To take a deep dive into the importance of naturally healthy cattle and get management tips for improving animal welfare, we invited two expert vets to share their experience and insights on the value of breeding healthy dairy cows. Peter Raundal, Senior Specialist and Vet Team Leader at SEGES Innovation, who is joining us online, and Casper Johansson, Supervising Vet at VikingGenetics. This is a BreedCast produced by VikingGenetics. I'm your host, Tomas de la Rosa. Hello and welcome, Peter, Casper. Thank you for joining us today.
Nice to be here.
Nice to be here.
Peter, let's start with you. Tell us about your experience as a farming vet and a cattle health specialist.
Well, yes, thanks, Thomas. I'm a vet. Yeah, I'm graduated from the University of Copenhagen in 1996. Went to mixed practice in the beginning, and then turned more and more into cattle practice. I left the practice work in 2008 and joined the Danish Dairy Board, working with some health programs we had, still have, eradicating Salmonella Dublin from the herds, and also our program for controlling Jones disease. But in 2011, I started a PhD in lameness in cattle and pain related to lameness. And since 2014, I've been at SEGES, working with cattle health and welfare. And recently, I became a team leader for the vets, working with cattle at SEGES. So that's my background.
And Casper, you have a slightly different background. Fascinating, shall I say. You also work at Raundal, which is a tropical zoo here in Denmark. How has it influenced your expertise in animal welfare?
I don't know if it has any influence on my expertise regarding animal welfare, but I also have a background in a mixed practice like Peter. And no matter if you work with dairy cows or dogs or cats or hyenas in zoo, animal welfare is basically the same.
Now, to get started, let's get straight to the point. Why is cattle health critical for a thriving dairy business, Peter?
I think it's very important for a lot of reasons. Firstly, the cattle health also is a big part, or being healthy is a big part of animal welfare. A sick animal is having a bad welfare, so to speak. So have a good health in the herd is also a part of the good welfare. And welfare is a major concern for the consumers. They want the animals that produce the milk for dairy products to have a good life, actually. So welfare is of high concern. But it also, for the farmers, it's they also like to work with healthy animals that are having a good life, so to speak. So also the farmers do have concerns about the welfare of the animals, but also the production economy is very much dependent on health and also on welfare. So it's very important in several aspects. Yeah.
Casper?
Yeah, that's true. I've never met a person who didn't believe in the fact that animal welfare matters. But animal welfare, I think, is also a subjective size. Because what is animal welfare? And I believe the freedom is a good aspect of seeing the animal welfare. And it says that the animal has to be free from hunger, thirst, fear, distress, physical discomfort, pain, disease, and freedom to express a normal pattern of behavior. And the challenge in this is that it can be difficult to have an animal that is behaving naturally, but still in the care of humans. So the human have to take that into account, because in the wild you have animals that is not they are experiencing hunger and fear. So when do you have to say it's need to have food 2 days a day, 2 times a day, 7 days a week, 365? That is not a natural way to express your behavior as an animal, at least. So it is funny, I think. But as in the dairy, we have legislations regarding animal welfare and animal health, and it is the same if it is in zoo animals or it is in dairy cows.
Now, Nordic cattle breeding data shows us that breeding for health pays off in the long term as the cows are in production for longer. What does longevity, a longer life, means for a farm's profits and animal welfare? Peter?
Yeah, it's quite important because the first around 2 years in production for a cow, a newly calf and cow, the first 2 years in production actually just pays the bill for raising that cow from it was born as a calf until the time of calving and starting milk production. So production. So the first among 2 years, they just pay the bill, so to speak. And so it's after the first 2 years in production that the farmers actually get a profit from that animal. So longevity should be at least 2 years of in production, and hopefully longer, because it's still expensive to raise a heifer. It takes around 2 years from small calf to it calf by itself. So it's costly, but it also in the topic of climate and carbon dioxide pressure, the calf also have the racing period, the 2 years of racing a new heifer is also they also produce carbon dioxide and methane. So in the climate budget, you could say it's also important that the production afterwards needs to be as long as possible to cover up for the cost on the climate for producing a new heifer.
Just to give some perspective to our listeners, do you know what the average cow longevity is here in Denmark?
It's something about around 2.7, 2.8 lactations. So the first 2 lactations is just paying the bill, and then there's on average 0.7, 0.8 lactation to actually gain profit for the farmer. But there's a very huge difference. Some cows only have 1 lactation, and some have 5, 6, or even 7 or more lactations. So there's a huge variation within the farm and also between farms.
And speaking about profits, high milk and solids production, they are naturally the most sought after traits. But good health and management, they can also significantly impact a cow's output. How can improving animal welfare directly result in a better quality of milk?
Well, it's many of the diseases do not directly alter the content of solids in milk. It's not that much as it's very difficult to affect, for instance, the content of protein in the milk. The content of fat is more reliable or on the or are more affected on the health status of the cow, especially when we talk about the diseases of the metabolism. But and also, of course, the milk quality itself is very dependent on other health. That's for sure. But the content of the milk is hard to influence by having it's more influence of feeding, for instance. So, but it's important to have healthy cows to have a high production, and that's where the main issue is when we're talking about diseases and welfare. That's keeping a high milk yield from the cows, and diseased animals does not give a lot of milk, so that's the main problem.
Casper?
Yeah, that's true. Healthy cow, they live longer, and they produce more milk, and it's good for the farm profitability. But on the other hand, you cannot say, at least that's my opinion, that longevity equals better welfare. It depends on how the animals are managed by the farmer. Um, but we also have regarding the milk quality. There are many factors, as Peter says, that's influencing it, I think, and genetic factors does also have a big influence on the milk quality.
Casper, how do we ensure here at VikingGenetics that our bulls have healthy semen production?
Yeah, as I just mentioned, that the legislation, we are under the same legislation as the dairy farmers, so we have these direction to follow at least. But we're having the animals in a quite a different way than the dairy farmers. We get a lot of bulls from all over the country and in other countries. So we're collecting a lot of old calves from different farms. So we have it's a bad standing way to start the life, because we have a lot of sickness coming in. So what we're trying is to keep the calves in small groups. We of course have tested them out at the farm, and when they come in, we test them again. We vaccinate them against BSV and ringworm, and then we measure the calves every 4th week. I measure the calves, so we follow their weight gain to see if they are being eating what they need to eat, so they're healthy. And then we also keep them in small groups in the beginning, and then when we're taking them from the quarantine to the other barn, we have them in big groups of calves. Because that is, they are social animals, and they need to be in groups. That is the normal behavior. So that we do, and we still measure them until they are 14 months. And of course, we don't need the bulls to produce as a dairy cow. So we also need to keep the body condition in form. So we don't need them too fat. We don't need them too skinny. So we primarily use grass insilage, no corn, because that's the main focus. Because we have some of the big bulls, so they are not meant to be with other bulls. At least some of them have some temper. So they're going by themselves, and it can, when they only eat and come up and do the collection 2 times a week, we could have an issue regarding the size of the animal. They're getting too fat. So we have also made an outdoor facility where we can get the bulls out, and they can have some big tires and move around with them and use some energy. Otherwise, we have I have a lot of good colleagues in the barn that is keeping an eye on the bulls every day, 365. And if there is anything that's not as it should be, they call the vet. And we also use an external vet to see the animals. We do the hoof trimming 3 to 4 times a year. And in general, just taking good care of the bulls.
A very good rundown of how we take care of our bulls here at VikingGenetics, and we'll get further into management of dairy cows later on in the episode. Peter, in the subject of semen production, cattle health also affects fertility. Why and how does this happen?
Well, diseases in dairy cows does affect the fertility. Diseases produces some substances that impairs the reproduction cycle, impairs the hormones of the reproductive cycle. For instance, lameness, that's a good example, because it's affect the fertility in several ways. The pain connected to lameness itself impairs actually the hormone cycle of the reproduction cycle in cows, and also it impairs the feed intake, creating a negative energy balance, and that also impairs the fertility of the cows. And more, you could say more simply, the pain in the hoofs, and it's especially in the rear legs, where the hoof lesions are located. It also makes the cows reluctant to mount other cows, and also make them reluctant to accept mounting from other cows. So the farmers does not see the heat, because they are more quiet and less active. So in several ways, it impairs the fertility. Also, of course, if you have uterine infections, that's creating a bad environment for the fertilized egg. So that also makes a higher rate of fetal death. So in several ways, it affects the fertility of cows. When the bull is sick, it might have fever, and that's a bad thing for semen production, a high temperature in the body. So in terms of bulls that will have been sick is also leading to impaired fertility.
And suppose our listeners want to learn more about innovative Nordic dairy farming and breeding. In that case, we have an episode of the BreedCast featuring the owner of Arla's Innovation Farm in Denmark and 2 farming innovation experts, which I think you guys should listen to. We've discussed why good herd health is so critical for dairy farmers. Now, I'd like to tap into your experiences with Nordic cattle and talk about the relationship between health and genetics. What are some common health issues which farmers can address by using the right genetics, Peter?
Well, I think they have to be in very good collaboration with their breeding advisors and have a breeding plan where they can put more weight on the health issues. But that's up to that's a decision that the farmer should take based on the advice from the breeding advisor. And I guess we, at least in Denmark, has a very good system where farmers can get advice and have a breeding plan for his own farm. And by that, he can, over the years, have a better, you can say, a better genetic pool in his dairy herd that also have a better merit for health.
Casper? Yeah, I think it's a good idea to look into the genetics, that's for sure. We have other health and hoof health breeding values, so that for sure would reduce the frequency of mastitis or hoof disorders. But as mentioned before, it doesn't stand alone. It's a good basic point to have the genetic. But it's also the management that needs to be in the right place regarding both mastitis and hoof disorders.
Also, a comment on the of the recording we have in the Nordic countries. We are recording a lot of diseases, lameness, or sorry, not lameness, but hoof diseases, mastitis, and everything. So we have a lot of data to get into the Nordic breeding programs, and I guess that's one of the strong or good things about the Nordic breeding system, that we have a lot of data on health to provide a more, you can say, a more a breeding index that take health into care.
And since we speak about all of this data that we have in the Nordic Total Merit Index, in the NTM, a farmer's choice of breed can greatly affect animal welfare. As some, for example, the red dairy cattle, the Viking Red, they've been bred for health traits more than others. Why is choosing a naturally healthy breed so beneficial, Peter?
It's in my view, it's about creating a robust cow. Because it's in an environment where they have high production and therefore also high demands on feed and access to comfortable beds, access to water. But still, it's an environment where they need to produce a lot of milk every day. So that's also making them more prone to get a disease, to get lame or to get mastitis or other diseases. So it's important to have a cow that is more resilient, you can say, so they can deal with all the exposure of bacteria or exposure from the hard surface of the allays and so on. So it it can better cope with the environment that are in the stables. So that's one of the reasons why it's important to have to breed for better health.
Casper?
Yeah, true. It is important, and I think also we have to mention the crossbreeding. Because we have at least the Holstein some dairy cattle that are having a high production of milk, and they are prone to be in what I call it the heat stress, at least, and some of the Holstein are they're more prone to be affected by heat, and also Holstein are more receptive for digital dermatitis. So when you take some of the naturally healthy cow and you crossbreed them with the Holstein, that is a high producing dairy cow, that's a good way to do it, in my opinion, because you take some of the best from both races and put them together in a crossbreed that is more working or functioning better in our system. And of course, if you are in climate, so with a tropical climate with high humidity and warm, that is maybe not the best place for a Holstein cow. You have to be aware of other breeds to crossbreed with. Yes.
Over some of the genetic trends that have come up over the last few years, pole genetics, it's increasingly becoming a focus when talking about animal welfare. What are the benefits of pole genetics, Peter?
Yeah, in Denmark it's mandatory to use anesthetics before you despot or dehorn a calf. It is also strongly recommended to use painkillers. But still, you are, by using hot iron despotting or dehorning, you are creating a third degree of burn. Two places in the skull, so there will be pain, despite you using both anesthetics and painkillers. The calf will feel pain afterwards. So using pulled bulls or bulls that create pulled calves will definitely improve their welfare, because it's not necessary to use the hot iron despotting. So yeah, that'll be beneficial for the calf, definitely.
Casper?
Yeah, true. And now we have the genetic where the heterozygote polled bulls are at least at the same genetic level as the best AI bulls on the market. So that is the way to go, I believe.
And our listeners can also have a more profitable, trouble-free dairy herd with world-class Nordic genetics. To discover what VikingGenetics breeding bulls are available, please visit vikinggenetics.com and browse a selection of Holstein, Jersey, Red, and Beef bulls. We've discussed what steps and improvements dairy farmers can make to get the most out of their herds. Now, let's talk about management and what farmers can do to optimize and improve their health and welfare in their farms. As we've been speaking all throughout in the Nordic countries, we have a huge emphasis on animal welfare, health, and food safety. What makes our practices stand out globally, Peter?
I think one of there's several things. We have quite new barns actually in Denmark. Most of our cows, and it's more than 95% or so of the cows are in free stalls. Relative new buildings. We have had recommendations of building stables that take welfare into account. We have very detailed legislation. For instance, it's forbidden to have a stocking rate more than one cow per bed, and the cows should also have at least 8 square meters of area. So it's we have a lot of detailed legislation also, and I guess that's one of the good thing about the milk production in Denmark, that we have a high standard for welfare, I guess, also compared to other countries.
Casper?
Yeah, true. But we also have in Denmark a so-called veterinarian advisor service contract with farmers having more than 100 cows. You can also do it on a voluntary basis if you have less than 100 cows. But the fact is that when you are putting the farmer and the veterinarian in this case together with this contract, for the farmer, it's he has medicine available on his stock, and he can treat specific diseases. That is in a what do you call it? You can work together with the veterinarian, but also having the focus on improving the animal welfare and preventing and controlling diseases. I believe it's a major step in Denmark, or the Nordic countries at least. Well, the farmer have frequent visits from the veterinarian, and together they make health plans regarding the preventive or the treating or the animal welfare. So that is a good thing that they work together to achieving the goals on the farm. I think that's a very good thing in Denmark, and that is also, I think that what do you call it? You can call it the result is also pretty obviously now. You can see that we have a decrease in the antibiotics during the last decade. For I believe Peter can correct me, but 20% decrease in antibiotics. And this year, in January this year, we had a historical low cell count for the average cell count for 165,000. So we are on the right track, that's for sure.
Now let's dive into some management tips for our listeners. Why is good management so important, and how does it complement genetic factors? Peter?
Yeah, it's very important. Good management is, I guess, it's the most important thing. Keeping healthy cattle in our production. I want to focus on the transition period from about 3 weeks before calving and 3-4 weeks after calving. That's a very, very crucial time for the cow. So I think we need to have more focus on the heifers, the first calving heifers, at first calving and the weeks afterwards. And when I say focus, it's also how we house them, how we manage them, how we house them after calving. If they are put in together with old cows, they are in high competition for getting to the feeding table, getting to a comfortable bed, getting to the drinking water throw. So and they can meet a lot of barriers because they meet dominant cows that can keep them away from the feeding table, for instance, and they need to go to the feeding table quite often. So the heifers, the first calving cows, are very much prone for getting diseases, and some of the things you actually don't see until it comes to the second lactation or maybe even third lactation. But some of the damage, and now I'm talking about the lameness or hoof. Some hoof lesions are actually created around first calving, although we first see the actual disease in the second or third lactation. So we need to focus more on the first calving cows, I guess. And the other thing is that it's very, very important. That's in the UK they have this abbreviation. They call it EDPET. It stands for Early Detection and Prompt Effective Treatment. And they created it again when they talked about hoof health, but it's actually in general, I guess. So the farmer and the staff at the farm needs to be very, very aware of actually each cow. Although there may be 500, 800 cows in the herd, they need to have focus still on each cow, so they can spot the cows that are getting sick, because otherwise it will be in the herd maybe for a couple of days before you realize that it's getting sick, and then it's just very, very difficult to help the cow. When it's mastitis, you actually see it right away because you are milking the cows two or 3 times a day. But when you talk about other diseases, it might be difficult to spot them in the herd. So the staff has to be educated. They have to know what they should be looking for. it's not only lameness, but it's a variety of other expressions that you can actually see on the cow that is indicating that this cow is more or less in getting into some kind of a sickness. So, and then they need to know what to do. Should they call the farmer, or should they separate the cow immediately, or at next milking, or what should they do? And then they need to take care of that cow. I think that's a major issue in large herds today, that that the time looking at each cow is very, very small, or very, very it's the farmer has very, very little time to look at one single cow, and therefore they are often overseen if they start if they are getting sick. So they are overseen for a couple of days, maybe.
A very detailed rundown of things farmers should focus on. Now, throughout this discussion, one big focus when it comes to management has been ultimately the impact of mastitis. As I mentioned early on in the episode, in the Nordic countries, we have the world's lowest use of antibiotics. What can farmers do to improve the herd's mastitis resistance and maintain their performance? Peter?
It's when it comes to mastitis, it's also very much rely on good management. Good management in the herd, have clean cows, and also keeping up the milking procedures. That should be on the top level. They should have a very skilled milkers that are educated in the milking procedure. They should have a milking procedure scheme. It should be a way of doing milking in the herd. And also keeping low infection pressure is very, very important. So clean cows in the barn are clean cows in the milking parlor, but also have as few infected cows as possible. And that could be a hard time to get to have very few infected cows. But when a farm is there, there's a lower infection pressure on all cows. So it helps them keeping a good udder health. The milk procedure is very important, pre-dip and definitely a post-dip. Milking clean tits is also very, very important. And also a dry-off scheme. So you try to focus the use of antibiotics at dry-off instead of using it to treat new cases of mastitis in the lactation, because there's a higher rate of success when you're using treatment at dry-off instead of using it in lactation. Of course, if a cow gets sick of mastitis, you have to take care of it. But you need, as a farmer, you need to decide, is this a case that you need to treat right away? Could I take a milk sample and wait until I have the result of the milk sample, then decide if I had to treat it or not, or should I not treat it at all? So the farmer should get into a dialogue with his vet, and they should have a mastitis treatment scheme and a plan for that. And the milkers should be very aware of the scheme, so they know exactly what to do when they see a cow with have signs of mastitis.
Casper?
Yeah, it is a bit difficult to make an overall generalization of how to prevent hoof or mastitis in the farms, because what worked in one farm might not work in another farm. That at least what I've learned in my 10 years in dairy practice. But also, as Peter mentioned, taking the veterinarian to the problem, and also taking milker technicians or AI technicians, taking some of the people who is having their dealing with the farm animals, and take them into consultants regarding what we can do with the problems we want to have solved. So reach out. That is one of my the cornerstone is to reach out to people. So there are many people around the farm that, at least in Denmark, that's what I know, are willing to help, and they are putting an honor in trying to establish some preventive measures so we can reach the goal.
And to wrap up, do you have any final thoughts or messages for our dairy farmer listeners keen on improving their herd's health and welfare? Casper?
Yeah, I would say choose the right genetic for your cows to improve health and focus on preventing diseases. And again, reach out if there's any issues you want to have solved. Reach out for your veterinarian, your milking technicians, and other people.
Peter?
They should strive to have very skilled farm staff. They should hire skilled persons or have education programs. So it's so each person at the farm knows what he should he should work with and knows how to look at the cows and know how to intervene when he sees something that should be taken into or a cow that should have extra care. So have educated and skilled personnel. That's very important.
Thank you for joining us on the BreedCast today. We've discussed how breeding for naturally healthy cows is an excellent way to improve animal welfare and optimize profits. We also examined the role of genetics and offered management tips. If you want to learn more about VikingGenetics, our dairy and beef breeds, get tips and tricks for breeding and management, and much more, please visit our website, VikingGenetics.com. Huge thanks to Peter Raundal and Casper Johansson for sharing their insights. A huge shout out to all of you out there listening. If you have an idea for a topic in the world of dairy farming and cattle breeding you would like us to focus on, please visit BreedCast.com or message us on the VikingGenetics Facebook or Instagram pages. You've been listening to the BreedCast, innovative breeding in your ears. I'm your host, Tomas de la Rosa. Please join me in the next episode as we discuss the advantages of genomic sires and the merits of daughter-proven bulls with 2 expert cattle breeders.